My name is Dr. Savannah Clary, and I'm part of the clinical team here at Aegis. This is a topic that often generates a lot of questions related to toxicology result interpretation. We're discussing the impact of poppy seeds. While this may seem far-fetched or unlikely to some, there's actually quite a bit of scientific literature discussing the possibility of detecting morphine and/or codeine following ingestion of poppy seeds. Our learning objectives for this webinar are to list common dietary sources of poppy seeds, describe morphine and codeine toxicology findings noted in medical literature related to poppy seed ingestion, and interpret definitive toxicology results and identify scenarios in which poppy seeds may be appropriate to include as a possible source for explaining unexpected results. Poppy seeds come from the Papaver somniferum or opium poppy plant. Poppy seeds are a naturally derived source of morphine and codeine and are used in a variety of food products. Interestingly, it is not actually the poppy seed that contains the opiates, it is contamination of the seeds with other parts of the plant during harvesting that results in opiates being delivered via the seeds. After harvesting, poppy seeds can be further processed by washing, soaking, or grinding them, which can reduce the opiate content on raw poppy seeds by 25% up to 73%. Opiates that are present on poppy seeds may be further degraded by oxidation or heat during baking. Baking may contribute to opiate losses of up to 80% to 90%. There are several food products that contain poppy seeds, such as breads, cakes, cookies, packaged snacks, bagels, rolls, casserole-type dishes like poppy seed chicken, salad dressings, and poppy seeds can even be brewed into a tea. There are numerous videos on social media demonstrating new and creative snack ideas incorporating seasonings that contain poppy seeds, like everything bagel seasoning. When dining at restaurants, we may eat poppy seeds without realizing that they've been incorporated into the dish we have ordered or as an ingredient in the dinner rolls. I remember myself recently eating somewhere and seeing poppy seeds in the dinner rolls and didn't realize that that was part of those rolls. Some individuals may consume poppy seeds less often or unintentionally, while others may enjoy certain poppy seed containing foods on a more regular basis. We should discuss poppy seed tea just a bit more because of the potentially dangerous aspect of consuming this tea. There have been numerous reports of overdoses and deaths related to poppy seed tea consumption. One well-known example is a 24-year-old young man who was found deceased in his apartment with no signs of foul play other than a 5-pound bag of unwashed poppy seeds, which, as I mentioned, the washing process reduces the opiate content. So these were unwashed, as well as a 33-ounce bottle filled with poppy seeds and water. The young man's autopsy confirmed high amounts of morphine and codeine in his blood, which likely caused respiratory depression and death. Another interesting news story comes out of Oklahoma where a couple were criminally charged related to an online bakery retailer that they operated which sold unprocessed poppy seeds. These seeds contributed to at least one death from consumption of tea made from the seeds, and the couple received over $12 million in revenue over a 3-year period, and if convicted, they could face life in prison. Poppy seed tea consumption, regardless of the intent or the amount, is worth discussing with patients to ensure that they understand the risks and possible harms associated with this practice. Having mentioned so many ways that individuals can ingest poppy seeds, now let's turn our focus to understanding how poppy seeds can impact the interpretation of opiate test results after definitive testing. As a reminder, definitive testing utilizes chromatography and mass spectrometry to differentiate drugs from one another, so when codeine and/or morphine are detected after definitive testing, it is a true positive, but it can certainly be unexpected if an individual is not prescribed one of these drugs. This chart on your screen is from the Aegis Clinical Reference Guide and shows possible sources of codeine and morphine after definitive testing. When evaluating unexpected codeine positives, clinicians should rule out pharmaceutical preparations containing codeine, including tinctures of opium, belladonna and opium, or B&O suppositories, codeine-containing cough suppressants, which may be more easily accessible in some states than others depending on state-controlled substance law. And it can also be present as a pharmaceutical impurity in morphine and hydrocodone. Codeine is also a potential metabolite of heroin. Morphine has similar possible sources, so when evaluating unexpected morphine positives, in addition to morphine pharmaceuticals, clinicians should rule out the same possibilities as with codeine, except regarding pharmaceutical impurities. There are different possibilities there. Morphine can be a pharmaceutical impurity in hydromorphone. Also, morphine is a metabolite of codeine. A detailed discussion of pharmaceutical impurities is outside the scope of our discussion today, but we do have additional materials available on this topic. If you would like to reach out to the clinical team after listening to today's webinar, you can do so and follow up with those questions. Lastly, notice that poppy seeds are also listed as a potential source of both codeine and morphine. This would not be considered a false positive, but would be an unexpected source that may not be discussed prior to testing a patient. Following consumption of poppy seeds, and depending on the amount and how the poppy seeds were processed and prepared, morphine and/or codeine may be detectable in oral fluid or saliva up to 4 hours and in urine up to 48 hours. Scientific literature documents the potential for morphine and/or codeine to be present following ingestion of poppy seeds. Many studies have found morphine present in urine at concentrations up to 2,000 nanograms per ml, and a few studies have detected urine levels in the 10,000 to 18,000 nanogram per ml range, possibly from poppy seed tea consumption. Oral fluid concentrations of morphine and/or codeine are typically under 300 nanograms per ml following poppy seed consumption. More recent literature has identified the possibility of codeine to be detected alone or in excess of morphine concentrations. Previously published data typically indicated morphine concentrations would be expected to exceed codeine concentrations. This newer literature regarding codeine concentrations after poppy seed consumption includes a case report of a subject who consumed a poppy seed containing bread and produced urine toxicology findings for codeine and morphine that looked identical to codeine ingestion. Another publication documented urine toxicology findings of codeine alone after consumption of various store-bought poppy seed containing foods such as grocery, bakery, lemon poppy seed muffins, everything bagels, and poppy seed cakes and cookies. Researchers noted that codeine concentrations did not exceed 1,300 micrograms per gram of creatinine. Generally speaking, toxicology findings are dependent upon the amount of poppy seeds consumed, the time since elapsed ingestion, the type of poppy seed preparation, whether food grade versus unwashed, and the concentration of urine, if applicable. This is an example of how AEGIS reports an unexpected morphine positive in urine. The comment states test result may be due to the use of pharmaceutical morphine or codeine, or from eating poppy seed food products such as bagels, muffins, salad dressings, etc. This comment was implemented to report with unexpected urine morphine results under 2,000 nanograms per ml, as this has been a widely recognized threshold in literature under which most poppy seed food consumption is likely to fall. Currently, there is not a comment that's associated with unexpected results in oral fluid or unexpected codeine results regarding the possibility of poppy seeds. Regardless of any comment issued on a report, our clinical team always welcomes questions from our clients regarding any possible result interpretations. When evaluating unexpected morphine and codeine toxicology results, it is suggested that clinicians first examine the possibility of any previously unrealized opiate prescriptions that contain or metabolize to morphine or codeine. This could include prescriptions dispensed in the outpatient setting or prescription drug exposure that might occur in a clinical setting, such as the emergency room or while inpatient at a hospital, for example. If no such prescriptions are found or no administration records are found, review the concentration of morphine and/or codeine relative to the literature that we've discussed to determine if poppy seeds are a possible explanation. It is not uncommon to see parent drug-only results after poppy seed consumption. Seeing only the parent drug is not definitively associated with poppy seeds, but it is a possibility. Considering the lower concentrations in general that are expected, and also if ingestion was recent, these factors could contribute to parent-only findings after consuming poppy seeds. Also, in testing for morphine, we hydrolyze the glucuronide metabolites that may be present in the urine to report parent morphine only. While morphine undergoes minor metabolism to hydromorphone in some individuals, this is less likely to be observed secondary to poppy seed consumption, as the normal ratio of minor metabolism would likely result in an undetectable amount of hydromorphone relative to the morphine that would be present potentially following poppy seed consumption. Thus, absence of hydromorphone with an unexpected morphine positive is not necessarily a differentiating factor. Parent-only coding results in urine would trigger the reporting of our "no metabolites detected" comment, which you're welcome to call and discuss further with the clinical team. But again, a parent morphine or coding only and likely a low concentration result is possible secondary to poppy seed ingestion. Our clinical team is ready to answer any questions that you may have. Many of you may have spoken with us in the past regarding this very topic or other toxicology questions, and we are always happy to speak with you. You can reach us by phone or email as noted on your screen, and we do truly welcome your questions. We want to help simplify your use of toxicology testing so that you can focus on the benefits it can offer with making clinical decisions. Thank you so much for listening to this webinar, and please reach out with any follow-up questions. And here are today's references. Thanks again.